clear up some issues with foot typing. This patient has posterior tibial tendon dysfunction, and this hasn't been corrected with the use of an AFO brace. Matter of fact, we're getting ready to perform a surgical correction on her. If you look at her foot, and if we foot type her, we get her in root neutral position, below the 4th and 5th met. Her heel is actually, you cannot invert her heel to neutral, so we would consider this to be a flexible rear foot. Now her forefoot, if you look at the front here, in the same condition, if you push up on her first ray, you can see it goes above the 5th. And also when we press down, it goes below the 5th. So we would call that a flexible forefoot. So she has a flexible rear foot and a flexible forefoot. But you have to be careful on how you treat this, because if you look at her foot closely, let's look at the front of her foot. You can see from this angle she is in a fairly varus position, which is the terminology most people are familiar with. So, if we load her up, we can see that she's getting her forefoot is not pronating extremely largely here. So, if you were to put a hypercure in her, this would actually increase your varus in her first ray. So, even though she has a flexible rear foot, we're not going to treat her with a hypercure. If you look at her first ray, and you do what traditionally is done, if you examine the first ray as you dorsiflex from the second, or plantar flex to the second, you can see it maintains the same position with the second, in both positions. However, in the 5th, if you compare it with the 5th, you can definitely see a difference between the 5th. You can see no difference between the second, so that would skew your treatment option if you were to look at the second metatarsal. So the way we're going to treat her, if you look at the side view of her foot here, her knee extending, you can see that she definitely has equinus, with that forefoot varus that y'all are kind of used to talking about. When we bend her knee, that equinus actually resolves. So we're going to do a gastroc equinus on her and a gastroc recession. To correct this elevated first ray, or high supinator end range motion and pronator end range motion first ray, we're going to go in and do a cotton procedure to pull her arch down like that. So to treat this patient, it would be more appropriate to do the cotton to stabilize her first ray downward and plantar flex it, and to correct her gastroc equinus. Would not be appropriate to do the hypercure because she has a forefoot varus which would exacerbate with the hypercure. So if you were to examine this patient in foot typing, and you were to look at your second ray, it would look like the first ray is not elevated or even plantar flex or not hypermobile as the terminology is most commonly used. However, if you look at the 5th ray, it in fact has a high supinator end range motion above the 5th ray and below the 5th ray. In the foot, the axis of motion you're going to see are going to be in the heel. This is when we're on our foot and in mid stance. The axis of motion will be on the heel, the first ray, and the 5th. That's why it's important to kind of examine those areas of the foot when foot typing a patient.